Welcome back mga kasambahay! Ngayong araw ay pag-uusapan po natin ang tungkol sa colon cancer. Para po sa paunang detalye, panoorin po natin ito.
Sa buhay ng tao, maraming mga pangyayaring hindi inaasahan. Tulad na lang ng pagkakasakit. Maraming tao sa mundo kasabay ng pagtanda ay hindi maiiwasan ng pagkakaroon ng karamdaman. Gaya ng pag-aaral ng World Health Organization, ang sakit na colon cancer o kilala rin sa tawag na colorectal cancer ay mas apektado na magkaroon nito ang mga nasa edad 50 pataas. Dagdag pa nito, ito ay nahahanay na pangatlo sa pinakakaraniwang cancer at pangalawa sa pinakadahilan ng uri ng kamatayan sa buong mundo.
At para sa mas malawak at mas maintindihan pa po natin ng maayos ang tungkol sa colon cancer, we are honored to have a distinguished guest, a leading expert in the field of gastroenterology, who is here to shed light and share her insights on a crucial topic of colon cancer that could be life-changing. So without further ado, let's welcome Dr. Adi Olympia Chang, a gastroenterologist from Makati Medical Center. Hi Doc, good morning. Welcome to Doctors on TV.
Magandang umaga mga kasambahay.
Okay, so ito Doc, no, sa paunang tanong, so pag sinabing colon cancer, what exactly it is? So para lang merong paunang information ng ating mga viewers.
So ito yung cancer or malignancy po na nakikita natin sa malaking bituka or yung tinatawag nating large intestines or colon. Okay? Usually starts as a polyp, maliit po na kuntil na tumutubo po sa loob ng ating colon, tapos eventually over a span of say mga 10 to 15 years, pwede po siyang maging cancer if left unmonitored.
I see. And ano po usually yung mga manifestations ng mga patients na nakikita nyo, okay? Or yung mga patients na merong colon cancer. So ano yung nararamdaman nila? And ano yung mga nakikitang mga senyales, okay? And or yan ba ay sa una wala? Or I mean, pagdating po sa klinik nyo, ano po yung magbibigay ng hint sa inyo? Chances are colon cancer to.
Okay, so usually dadating sila sa clinic dahil may problema sila sa pagdibi. Usually constipated sila or meron silang bloody stools o dumi na may dugo. And then usually pag medyo late stage na, may accompanying na weight loss, kakik siya, wala nang ganang kumain. Okay? And then sometimes may abdominal pain din sila.
I see. Pero ito bang mga sintomas na to, do they come and go? Or persistent sila?
If it's persistent, then most likely it would be more suspicious of colon cancer, especially when you see them mga 60 years old. Usually 45 years old and above, they can start coming in already. But usually kapag elderly with the symptoms of weight loss, bloody stool, constipation, changes in bowel habits, ito yung usually pag iisipan namin na may colon cancer.
I see. And usually, so na-mention nyo about usually mga mid-adult age na po. And kalimitan, gender-wise, meron ba yung mas predisposed ba yung babae or lalaki?
Well, apparently, parang pareho lang naman. Okay? It's more of a matter of family history and then may mga risk factors din sila.
I see. And which are?
So, risk factors include smoking, mga bisyo, alcohol, and then if they have a family history or mga close relatives, father, mother, or mga who've been diagnosed with colon cancer or nakitaan ng polyp sa colonoscopy. Those without these risk factors, we would categorize them as having an average risk for colon cancer. But if meron silang mga kamag-anak na merong colon cancer or nakitaan ng polyp sa colonoscopy, then ito, high risk na sila for colon cancer.
Okay, so basically, having known lang na meron kang kamag-anak, okay, so basically may genetic predisposition, you should have yourself monitored, okay? And
Yes.
para makita baka nga mamaya, sakto may finding pala ng mga polyps and the like. So that's when that parang increases, okay, the risk of having colon cancer.
Yes, in fact, for those who are at high risk for colon cancer or those who have relatives who have colon cancer, we usually advise them to have colonoscopy done 10 years earlier than the age that their relative was diagnosed with colon
Oh,
cancer.
so ulitin natin, kunyari may na-diagnose na kamag-anak at 50 years old. So dapat dahil being you having like kahit papano may risk ka no of having the same illness, might as well 40 years pa lang nag-uumpisa ka na magpa-monitor.
Yes, that is correct.
Okay. And ano bang cause ng colon cancer, Doc?
Hereditary talaga siya, no? Malaking bagay talaga yung meron kang relatives. But then again, if you also smoke and drink, some studies say mga processed foods, mas prone ka to trigger the polyp to transform into cancer.
So basically multifactorial.
Yes, it's
Okay.
multifactorial.
Pero meron bang ano dyan? Can it be of viral etiology also?
Viral, not so much, but over the past few years, especially nitong pandemic, we have been seeing more cases of colon cancer. If it's related to COVID, we have no hard evidence yet, but I think they're looking into it. It may be na their immune system was dampened because of the COVID, and then the colon cancer then spreads or it forms easier than compared to if you do not have a immunocompromised patient.
So talagang papasok pa rin dito dapat laging very competent yung ating immune system.
Yes.
Okay. And okay, balikan natin Doc yung sa pathophysiology ng colon cancer, no? So, say for example, ang isang patient who has yung mga risk factors already, tapos sakto nagkaroon ng polyp. In your practice, so usually ganong katagal yung development or progression of this polyp to becoming a colon cancer?
Well, sources usually say 10 to 15 years for a polyp to become malignant. That is exactly why when we start screening colonoscopy and then they say na we find that there's nothing, no polyps, we usually recommend another colonoscopy after 10 years. Kasi in spite of the fact that we did not find anything, in the next 10 years, pwede rin may tumubo pa din.
Oh, okay. So basically, kung wala ka nakita ngayon, so dapat may consistent follow-up and monitoring. And okay, so in the event na diagnose na nga ng colon cancer, Doc, usually, di ba kasi like any other cancer sa katawan, takot tayo pag magme-metastasize. Ibig sabihin po nito, ang mga kasangbahay yung kakalat na po, no? Usually, paano ang spread nito? Kasi sinasabi natin, di ba, ang cancer pwede siyang hematogenous, pwede, ibig sabihin sa dugo, yung iba naman pwedeng sa kulani, iba naman ay pwedeng direct invasion, ibig sabihin na kung may yung kalakip or katabi na body structure, yan pwede. Pag ito po sa colon cancer, paano po yung manner of spreading?
Usually, ang una nang tatamaan liver.
Liver.
Yes. So usually pagdadating sila sa clinic tapos nagkataon na end stage na sila ng colon cancer with metastasis na sila, aside from yung bukol na nakita sa colonoscopy, minsan nakikitaan din namin sila sa liver. So it's very important to have a whole body scan on top of the colonoscopy.
I see. But does it happen na hindi na-diagnose yung colon cancer? Ang mas nakita yung next na pinaglipatan. Like for example, ang manifestation ng patient would be ng liver cancer, liver problem. And then, biglang makikita, okay, so basically, ang primary pala, ang pinag-umpisahan pala ng liver cancer would be colon cancer. Does it happen all the time?
Yes, it happens a lot. It happens a lot. That's why we really fight for screening colonoscopy. Because most of the time, lalo na tayong mga Pilipino, no, mahilig tayo magtiis. Ayaw natin nagsasabi sa mga kamag-anak natin kapag may nararamdaman na tayo, no? So usually, pag ganyan, we usually fight for screening colonoscopy. At age 45 years old sana, magsimula na tayo mag-screening colonoscopy para maiwasan pa na maging cancer na to. Or sometimes yung makikita na lang natin, may kalat na tayo sa liver.
I see, or anywhere else.
Or anywhere else.
Yeah, apart from the liver, usually saan pa ho ito nangangapit bahay? Itong
Pwede rin
colon
po sa
cancer?
lungs.
Lungs.
Yes. And yes, yung direct invasion can also happen. So, kakalat rin yan eventually sa peritoneum natin.
Dito sa loob ng tiyan?
Yes, sa loob ng tiyan.
Okay. And usually ba, you mentioned about one of the signs would be yung pagkakaroon ng dugo sa dumi. Okay. And apart from that, but can colon cancer present with pain or severe pain?
Yes, it can present with severe pain, especially if we already have obstruction or siya ay bumabara na sa bituka natin. So, because may bara doon, yung ating bituka, ang kanyang reaction is to move to try to get rid dun sa bara. So, magiging painful yun. Other than that, dahil sa natatrap na yung dumi before that obstruction, natatrap din yung hangin, di nakakalabas. So pag umiipon yung hangin doon, magdi-distend yung ating colon. Lalaki po siya ng lalaki, lolobo ng lolobo.
Pati tiyan, lolobo.
And yung tiyan lolobo, tapos yung distension na yun will manifest as pain for the patient.
So I can just imagine how uncomfortable with
Yes.
that would be for the patient. So,
Actually, we have a lot of ER patients na dumadating dahil sa hindi sila makadumi, tas masakit na yung tiyan nila.
okay. So, does it mean mahirap mabuhay ng normal life? Okay, mabuhay normally ang isang pasyente with colon cancer?
Well, mahirap kung hindi siya iti-treat. If we catch it at a very early stage, there's a chance for 100% cure. Okay? Kapag na-cure yon, usually yung cure na ni surgical, tatanggalin yung mismong bukol pag wala naman nakitang mga kalat sa kolani kasi i-check rin yun during surgery and wala rin kalat sa ibang bahagi ng katawan, ibang organs, then the surgery in itself will be curative and the person can live a normal life after that.
So talagang babalik pa rin tayo dito sa early detection would mean
Yes.
early management and prevention of further complications. Naku, mga kasambahay, so we always reiterate that, napakaganda nga na lagi nating naririnig to, paulit-ulit man, pero ito ay nagsisilbi pong reminder sa atin para wag na nating palalain anumang sakit, hindi man ho dito sa colon cancer,